One of the scariest words that we hear when we're treating patients with skin cancer is melanoma. There's a lot of misconceptions about melanoma, some of them well-founded, some of them not so well-founded. Melanoma is a disease that's considered among the most lethal of skin cancers, but within melanoma there's a wide spectrum, from the very bad melanomas that are metastatic, meaning it's spread through the body, to the very early ones that are superficial and on the top layers of the skin that we can treat with simple in-office surgery and everything in between. When I started treating melanomas many years ago, surgery was the treatment, period. There wasn't anything else. But the last 10, 12, 15 years, all kinds of new therapies have developed for the treatment of melanoma. And I'm talking about advanced melanoma. So we've seen survival rates more than double in the last 10 years through the use of different targeted therapies and immunotherapy. So the most important thing is to, number one, check your skin. American Academy of Dermatology recommends everybody checks their skin from head to toe at least once a month, or on the outside every 2 months. And if you see something that's changing, then you should see a dermatologist to evaluate it. There are many moles that change and look weird and look awful that are very benign. And there are some that don't look so bad that are kind of sinister, and they're the kind of problem cases in some cases. So you want to get yourself checked. We recommend that everybody see their own dermatologist once a year to get their skin checked anyway. And then if melanoma is diagnosed, then we need to go and treat it aggressively and quickly. There are many ways to treat it. Ultimately, surgery is the first step. So, a couple of things. If you have melanoma, you're 9 times more likely to get another one, just by virtue of the fact that you've had one. It's the second most common cancer in females between the ages of 15 and 29. It's not just an old person's disease. Matter of fact, I see far more melanoma in younger people than I do in the elderly population. If you have a blistering sunburn as a child, your chances of melanoma increases. If you've had 5 blistering sunburns between the ages of 15 and 20, you have an 80% probability of getting melanoma at some point in your life. And finally, and most importantly, sunscreens. My recommendation is for people to wear sunscreen every day before you look out the window, whether it's raining, sunny, doesn't matter, just put some on those exposed areas. Because we know that the daily use of sunscreen decreases the mortality from melanoma by 50%. So take care of your skin, and it'll last for a long time.